Did you know that the NHS is the UK's biggest employer? In fact, it's one of the top 10 biggest employers in the world.
Just stand on the scales, will you please?
Back in the day, they used to say that working in the NHS was a job for life. Spend years training, complete thousands of hours of placements, and at the end of it, there'd be a job, well, waiting for you. But recently something has changed.
Why is nobody talking about the shortage of jobs for newly qualified nurses?
I applied for a job recently and they got back to me and mentioned that there was 350 applicants.
One of the biggest lies we were told when applying to medical school was, as a doctor, you'll always be employed. There will always be a job for you in the NHS. That, in fact, is not true.
Back in April, the Welsh Ambulance Services Trust announced a recruitment freeze, meaning no new paramedic student in Wales will be offered a newly qualified paramedic role this year. People who are literally trained to save lives are now facing unemployment. It's worth saying here that health is devolved in Wales. Now that means that decisions about NHS staffing, funding, recruitment are made by the Welsh Government in Cardiff. But listen, it isn't just an issue for Wales, and it's not just an issue for paramedics either. Healthcare unions across the UK are warning that new graduates are struggling to find work. New doctors, nurses, midwives, physios and paramedics.
Hi, I'm Lorna. I'm 26 years old and I'm a third-year paramedic student at Swansea University. You know, whether for us it's attending a cardiac arrest or a major incident where we're reviving people with horrible injuries, or we're attending an old lady who's struggling by herself. It's very rewarding.
Lorna is one of around 70 paramedic students graduating this year who won't get the job that she's trained for in Wales. Now, with the exception of doctors, normally when you finish an NHS-related degree, graduates could expect to get a Band 5 entry job, earning roughly £32,000. So in Lorna's case, that would be a newly qualified paramedic role. But basically, there aren't enough. Take a look at nurses. According to the Royal College of Nursing, more than 1,000 nursing students will graduate in Wales this year. But right now, there's only been 809 Band 5 roles identified for them so far by Health Education and Improvement Wales. They're the people responsible for NHS workforce planning. That means the RCN anticipate that more than 30% of nursing grads in Wales won't go into immediate employment. Now, these figures aren't final. More jobs could come up. But behind all of these numbers and warnings and maybes and press releases are people like Lorna, who've trained to work in our NHS and are now facing uncertain times.
Yeah, we've just spent 3 years of our lives dedicated to this career, thinking we'd have a job at the end. So yeah, people are just very disappointed, upset, angry.
So I've got a bit of an update for you, actually. Since speaking with Lorna about the impact of the paramedic recruitment freeze, some new statistics have actually been released. Now, these stats are about nurses, and what we now know is that 306 haven't secured Band 5 roles as of June 2026. On top of that, 70 midwives and 7 operating department practitioners are unfortunately in the same boat. Now, there is going to be another allocation phase at the end of July with the aim of matching graduates to the 131 remaining nursing roles, and it will help to reduce the number of people without jobs. But look, the key word here is reduce, because there's still going to be almost 200 of these grads left unemployed.
The pressure on emergency services is getting worse.
Corridor care has become a permanent fixture in hospitals.
Less than a quarter of hospital trusts in our region have met targets.
Ambulances queuing as far as the eye could see.
Right, what I'm finding confusing in all of this is the fact that we constantly hear about how much pressure the NHS is under. We report on it, and the data backs it up. Figures from March 2026 do show a decrease in waiting times in Wales for the 10th month in a row, but there's still more than 666,000 treatments waiting to start. Around 2,600 people have been waiting for more than 2 years. Ambulance wait times show the strain as well. Now, there are 5 different categories of ambulance call in Wales: purple arrest, red emergency, orange now, yellow soon, and green planned. Purple and red are for the most serious. Now, purple is used for people in cardiac or respiratory arrest who need an ambulance immediately. Red is for people who are at high risk of cardiac or respiratory arrest, who need help immediately. For example, someone who's choking. And while purple calls have always met their targets, response times for red calls have missed their median target of 6 to 8 minutes since the new category system was introduced last July.
We arrive to patients' front doors who have been on the floor for 8 hours plus. I actually previously worked in the 999 control room for the Welsh Ambulance Service, and I quite frequently gave people 10-hour plus waiting times. When demand got really bad, there was certain jobs we told people we weren't coming at all. It's just a big systemic NHS problem, which is quite shocking as well, because I know midwives, nurses, doctors who struggle at the moment to find jobs. We're all here, we want to work, we want to use the skills that we've learnt here, and we want to use them within the Welsh communities, but there's just no room.
And this is what I found to be one of the weirdest parts of all of this. The most recent NHS Wales vacancy data shows that in December 2025, there were an estimated 5,652 full-time equivalent vacancies across the Health Board. Now, not all of these roles are appropriate for new grads, but with that many vacancies, something isn't adding up. Do we need more staff, or do we not? If we do, we've just trained a lot of them, so why can't we hire them?
3, 2, 1.
Hi Jen, how are you?
Hey Meg, I'm good, you're right.
So Jenny, how did we actually get here?
It's a good question when you consider that the very service that is taking on these graduates a few years back will have mapped out how many they thought that they needed. They will have funded those places. But the thing here is that finances of the NHS are a big challenge. Now that's not news to us, we hear that all of the time. But what we've seen, for example, is just one of the health boards in Wales, and we've got 7 in total. One of them was due to take on 210 nurses, but it hasn't been able to. It's only able to afford 79. And that's replicated across Wales, that they simply don't have the money to be able to take on as many new staff as they thought they would. You've got a slightly different problem going on in another area. Call it a problem, call it a good thing, that staff retention has improved. So fewer people are leaving the profession. And that's great if they think that it's a place that they want to work. But it means that there are fewer vacancies and gaps, jobs for these new graduates to apply for. And so that's why we're seeing these problems come to a head.
Jenny, how can we have vacancies, long waiting lists, an NHS that is struggling, but then graduates who can't actually get a job?
I think this comes to the heart of the challenge for the NHS, that you need to get that staffing mix right. And let's take some time to explain that the NHS is doing way more than it ever used to. Generations before would not have had the service that we have today, whether that's because of advances in technology, in innovation, in medicine. We can get more from the NHS now, so it has to employ more people to be able to do those jobs, which is why it's one of the biggest employers in Wales today, but also the numbers of staff that it has are at record levels. The issue then, though, is that the staffing bill is big. And I come back to that big point about the finances, because the watchdog, the financial watchdog in Wales, Audit Wales, over the last year looked over the finances of the NHS in Wales and found that at the 3-year cumulative deficit, the overspend, if you like, was more than £460 million. It's huge.
And Jenny, what impact will this have on graduates?
These students have spent the last 3 years studying. They'll have been on placements. They'll have given up an awful lot, whether they're fresh out of school and going on to a job that they thought would be a really good job for life. Now, the narrative has been that the NHS needs staff, that there are vacancies, jobs to walk into afterwards. Whether you're fresh out of school or whether you're somebody who's got financial responsibilities and you're weighing that up. This was seen as something that actually was a good thing, you're a really almost guaranteed a job. And that actually isn't such a difficult thing to get your head around either when you consider that the NHS Wales bursary was on offer. Tuition fees would have been paid for you if you qualified for this bursary. There might even have been costs for your living costs as well, may have been covered for some of those students who are going through these courses. all of that feeds into this narrative that you're guaranteed a job at the end of it, because part of that contract is that you have to stay in Wales if you have a bursary and work for the NHS in Wales for 2 years. So I think that narrative is built up that there's a guaranteed job here. So many now have come out of this feeling quite bruised from the whole process, that there aren't the jobs that they were expecting. We've looked into this and found that actually the bursary, if you've ticked all the boxes and you've applied for jobs and those jobs weren't there, then they will relinquish you from that contract and you can go and work elsewhere. But I know that has been something that has played on students' minds.
And Jen, do you think this is just a problem in Wales?
So it's definitely not just in Wales. I think what we've seen here in Wales is that bosses are saying, kind of drawing a line under it and being quite clear that we cannot take on any at all in some sectors. I think what that does is underlines just how significant a problem is, but it also tells those who are funding and coming up with the policy, there's a problem here, we need to address it.
I reached out to the Welsh Government to see what they had to say on the matter, and this is what they sent me. We know how disappointing it is for this year's nursing, midwifery and paramedic graduates who haven't secured the roles they worked so hard for. We've asked HEIW to coordinate a national support offer, including a single point of access to ensure graduates remain supported and connected to emerging employment opportunities. The Cabinet Minister for Health and Care has already convened a graduate summit to find immediate solutions and prevent this from happening again, and asked for actions from the summit to be rolled out nationally. For obvious reasons, I started this research looking at Wales, but the more that I've got into it, it's clear that this is a UK-wide issue. The Royal College of Paramedics has warned of further recruitment freezes across the UK later this year. Back in July 2025, the British Medical Association surveyed doctors across the UK. It found 52% of Foundation Year 2 doctors finishing training said that they have no substantive employment secured from August when the new roles begin. This is in part due to major bottlenecks in career progression, with more than 30,000 people competing for just 10,000 specialty posts last summer. In February, a UK-wide survey by the Royal College of Midwives found that a third of midwifery graduates haven't found a job. Honestly, the list goes on. Different professions, different parts of the UK, but the same story. So big picture, what does this mean long-term for the NHS? If you want a job in it, will there be one there for you? If you use it, which you probably do, is it going to have enough people with the right skills to actually be able to look after you?
I think the long-term impact, if it becomes more and more apparent that some new graduates aren't able to find meaningful careers within the NHS, there's two things. Firstly, if this becomes a national problem, I think we're not there yet, but we're seeing sporadic and increasing reporting in different UK countries that it is a problem. If this becomes more national and in the media, there is a reputational risk for the NHS as whether or not it can be a good employer for new graduates. And I think we need to recognise that the NHS can only sustain service delivery through a good pipeline of newly trained health professionals coming into employment. If that pipeline reduces or is partly blocked, that in turn also creates service challenges. But I think the primary issue we've got to work through and try and prevent happening is any reputational risk which might make school leavers and others who are thinking about a career in the NHS think to look differently because they're not convinced they can get meaningful work.
We reached out to government in Scotland and Northern Ireland for comment on this story. They replied with the following. The UK government was also asked to comment, responding on the NHS recruitment freeze reported in April 2026. The government said this. I keep thinking about what Lorna said earlier, about reviving people with horrible injuries or sitting with an old person who's struggling alone. And it kind of breaks my heart that she and her classmates have done all of that amazing and, let's be honest, hard work. Right now, for nothing. As Jenny and Jim mentioned, this is something the Welsh Government and other UK nations seem to be getting worried about and taking some action over. But for new grads trying to enter the NHS this summer, the picture is still pretty bleak.
My plans for the future are still a bit unknown. There's been different options thrown out there. The university have tried to help us, our lecturers. They got us in contact with someone from New Zealand, a company in Canada, and also with the army, the British Army. I don't know what everyone else has gone for or hoping for, but for me, I will likely be leaving the UK.
A lot of healthcare workers might be feeling similar, and if they choose to change career or work outside the UK, well, it's going to impact all of us. Are you a healthcare graduate struggling to get a job? If you are, I'd really like to hear your experience in the comments. Thanks for watching.